So I'll start with the preoperative journey. So leading up to the surgery, you've made the decision, you've met one of those indications we already talked about, or a different one. And so you've decided to have the surgery. Well, leading up to the surgery, you need to avoid things like blood thinners, because of course, anytime you take a blood thinner, it's gonna affect the surgery and how easy it is for the surgeon, no matter what the surgery is. And so a lot of blood thinners that people don't think about are things like ibuprofen or naproxen. The NSAIDs, or non-steroidal anti-inflammatory drugs. So those can actually have a blood thinning property. And then of course there are the ones that people are prescribed for blood thinning purposes, or people who take a baby aspirin every day, things like that. So you'll want to avoid those leading up to surgery. And then of course there's the surgery day. For me as a surgeon, to remove tonsils, I go through your mouth. You're of course asleep for it, under a general anesthetic. I go through your mouth. Typically the surgery takes maybe 30 minutes or so for my part, and it's relatively straightforward. The hard part of a surgery for tonsillectomy is the recovery. So recovery from a tonsillectomy it's not an easy thing. Pain gets worse before it gets better. It's the worst sore throat of your life. There are odd ducks out there, like my sister-in-law, for example. I love her, but she told me that after her tonsillectomy, she felt better after 3 days, totally back to normal. Very much the exception and not the rule. The rule is about 3-4 days after surgery, the pain will really peak, it's really bad, and then it's bad for almost 2 solid weeks after surgery. And so what's really, really important is to stay hydrated, to take pain medications as are recommended by your doctor, and really stay on top of that. Other things to do are to avoid, funny enough, sharp foods, because those can theoretically scratch the back of your throat, which will be irritating for you and also theoretically increase the risk of bleeding. I had a colleague who would say, no Cheetos, no Fritos, no Doritos, nothing Eatos, which I loved that. So basically sharp chip things like that. The other things to avoid would be citrusy or spicy things, so salsas, orange juice, those things are going to sting, and so those are foods that you're avoiding for your comfort. So I already mentioned staying hydrated, really important, and then you also want to make sure that you're getting nutrition, not just ice cream and popsicles, which of course are great because they help you stay hydrated, but you want to get some protein too. So it's good to have protein shakes or other soft consistencies like chicken noodle soup or mashed potatoes, where it's that softer consistency. And then other activities to avoid are things that are going to raise your blood pressure. So for little kids, they need to stay off the playground for about 2 weeks, because that running around is going to raise their blood pressure and increase the chance of having bleeding after surgery, which sometimes bleeding after surgery is minor and sometimes it's more significant, and they're actually about 3% of the time there is a significant bleeding issue which needs to be addressed in some way, shape, or form, whether it's a conservative measure or even going back to surgery to get that bleeding to stop. But that's of course very, very rare, but it is why it's so important to avoid those activities that raise your blood pressure. And those I think are the major things.